live by, of course, our guest who will be joining us live via Zoom. That is Cleo Mtai, who is actually joining us live. Well, as the world continues to put its best foot forward in eradicating malaria, here in Kenya, interventions has been put in place by the Ministry of Health to eliminate malaria, including the issuance of mosquito nets in mass net campaign. But are you aware of the link between malaria and sickle-cell anemia? Well, Mutua, Cleophas Mutua, of course, Doctor, thank you so much for joining us here. Well, we have a very important discussion, and of course, I hope you're doing quite well.
Yeah. Thank you for having me. I'm glad to be with you, and yeah, I'm doing well. Thank you very much.
All right. Let me begin by, giving out, rather reading out some statistics from World Health Organization that actually paints a grim picture of this as far as the war between malaria is concerned. Well, statistics puts it that 247 million people, of course, suffer from malaria in 2021. That is an increase of about 2 million from the previous year, 2020. Well, 619,000 deaths have been reported, where in areas like mostly in sub-Saharan Africa, and most deaths are recorded in children. Of course, this begs the question, well, why is malaria still common in sub-Saharan Africa?
Yeah, thank you for that question. And you have rightly said that malaria is still an issue in sub-Saharan Africa, where our country, Kenya, is. And actually, it's important to note that it's not just sub-Saharan Africa. We have to bring it home. And where we know that, like in 2021, in our country, we had about 3.4 million people affected by malaria. And out of those 3.4 million people, we had 12,000 deaths from malaria. And malaria is still common in sub-Saharan Africa, majorly because it's the climate that funds the spread of malaria through the parasite, which is usually spread by the mosquito. And so, yes, it's still common in sub-Saharan Africa, majorly because of the climatic changes that we have. And also, of course, because we are still instituting measures to control the spread of malaria, which we are yet to cover the areas that we are supposed to cover. And that would explain why we still have malaria in the sub-Saharan Africa.
All right. Well, when you look at the measures, of course, that has been put in place, especially here in the country, as far as the war to eradicate malaria is concerned, of course, there is some gains that have been made, at least 50% prevalence of this. That is a gain, if you ask me. But why is the war, or rather, will the war against malaria ever be won, in your own opinion?
Yeah, I mean, yes, we are hopeful as doctors and the clinical community that yes, the war against malaria will be won, but it has to be a multi-agency, combat for this malaria. One, the way to control malaria is to use, the first thing that we are doing is using the mosquito nets which are treated. And these mosquito nets which are treated should be distributed. Like you rightly said, yes, there has been an improvement in the uptake of treated mosquito nets, especially in the rural areas. And this is what we really need to encourage, that we continue distributing them in our rural areas, especially the areas that are prone to malaria, so that we can be able to control the spread of malaria. We have also the treatment of malaria in especially the prone groups of people, the pregnant women and under 5s, where I am a pediatrician. So we encourage that these cases are picked early and treated early, so that we can combat this menace of malaria. And of course, it's important to also, there are other methods of controlling malaria using the barrier methods, the creams, using the other things like the insecticides. And also remember that from 2019, the government rolled out the malaria vaccines in the malaria endemic zones, which also has significantly helped to reduce the spread of malaria and also reduce the severity of the disease, and hence reducing the burden of malaria.
All right. When you talk about the malaria, the rollout vaccine, well, there is some, at least two regions, that is Western and of course Nyanza. But when I want to draw your attention to mostly Western, and to be precise, in area like, let's say, Sirisia, where it recorded 46%, that is positivity rate as far as malaria is concerned. Then we have Bumula, 41. When you talk about, the uptake of vaccine as far as malaria is concerned, does, this point to maybe lack of laxity as far as the uptake of vaccine is concerned in these two regions that I've just mentioned?
Well, it's important to note that the malaria vaccine has several effects when it's given to a community. The first thing is to prevent the infection rate and reduce the infection rate. But remember, the other aspect of the malaria vaccine is that it reduces the severity of the disease. So having a high prevalence of malaria in those areas does not necessarily mean that there's no uptake. We also have to look at the seriousness. When I say severity, I mean how many. Malaria is divided into two. There is complicated malaria and there's uncomplicated malaria. So we have to look at those particular areas and ask ourselves, are we having more cases of complicated malaria, or are we having more cases of less of uncomplicated malaria? Because the aim of the malaria vaccine is also to reduce the cases where the malaria becomes complicated, and hence reducing the number of deaths that occur from malaria infection.
All right. Well, when you talk about this, the uptake, and you give us a very detailed analysis of complicated and of course the other malaria. Now, I want us to switch attention to our main focus of discussion today, which is the link between malaria and of course sickle-cell anemia. In your own terms, probably, Doc, if you can, help us with this question, like what is the relationship between, malaria and sickle-cell anemia?
Well, first of all, it's good to understand what is sickle-cell anemia. Mm-hmm. Where sickle-cell anemia is a condition where it's a condition that is inherited, where someone's hemoglobin is more likely to, red blood cells are more likely to break down in particular conditions just because of the way the hemoglobin is, because of the way it's inherited, yeah? And also, it's also good to understand how malaria causes the disease, the disease-causing mechanism of malaria itself. Malaria parasite affects majorly the red blood cells as well, and causes the breakage of these red blood cells, leading to the symptoms that we see, the fever in hemoglobin. And so here you're having two diseases that are affecting the same part of the body, the red blood cell. The red blood cell is the part of the blood that transports our oxygen. When you say someone has low blood, usually we mean that they have less hemoglobin, and that hemoglobin component is usually carried in the red blood cell. So the thing about the malaria is that if someone who has sickle-cell disease, meaning that someone who has sickle-cell disease is more likely to have breakage of their red blood cells just because of the way their red blood cells are, if that person also gets malaria, and that malaria is likely to break those red blood cells more. So they are more likely to have a more complicated condition. They are likely to get more sick. They are likely to get a more drop in their blood level. They are likely to get a more symptoms. And I think it's important for us to also discuss the symptoms of, for example, malaria. Malaria usually gives you symptoms like fever. It gives you symptoms like low blood. It gives you symptoms like having yellowness of the eyes, just because when you break the red blood cells, you get yellowness of the eyes. So if someone who has now this more likely to, their red blood cells are more likely to break, if they get malaria, they are likely to have a more serious disease, and they are more likely to get complications of malaria, and hence they are more likely to die from the infection. And hence they talk about trying to prevent this people who have sickle cell disease from getting the infection of malaria. Yeah, and that's why we ensure that people who have a sickle cell disease are supposed to be on some medicine that prevents them from getting a malaria infection. I don't know that that made sense. It's a lot of medicine.
Well, actually, that brings me to another question that is, if you ask me, quite a bit confusing. Why are some people with let's say hemoglobin more resistant to malaria than those that without? I'm talking about high.
Sorry?
All right, let me rephrase my question. When we're talking about the relationship between, of course, malaria and sickle cell anemia, and there is some, statistics that was done that indicate that some people who have hemoglobin, of course, are more, resistant to malaria than others without.
Oh yeah, the research shows that the people who have a single copy, you see that for sickle cell disease, we talk about carriers and we talk about the people who have the disease itself. And sorry, I think you have disappeared. Yeah, so for those people who are carriers or have a single copy of the gene for sickle cell, those ones have been shown to be a bit protected from malaria. Okay, so that's what research has shown. But then for those people who have the sickle cell disease itself, have been shown to be more, they are more likely to die from the disease, like I've explained earlier on. So they are more likely to die when they get malaria than those people who have a single copy of the sickle cell trait. So that those people who are carriers or who have a single copy of the hemoglobin S are a bit protected according to research from severity of malaria. But then remember, for those who are sickle cell disease sufferers themselves, then when they get the malaria itself, then they are more likely to have more severe symptoms because of the factors that we had explained earlier on.
All right. Well, Doc, there is still another very disturbing factor that was established, and it concerned, let's say children under the age of 5 years, especially here in Kenya, who lives in Western Kenya. It said that those with sickle cells anemia are prone, of course, to malaria, especially those under the age of 5 years living in Western Kenya. What is happening, Doc?
Yeah, the thing is, all children under 5 years are prone to malaria, and also other special groups like the pregnant women. The fact that their children are living in Western Kenya, they are more prone to malaria, because you see, malaria is also distributed a bit geographically in our country. We have areas of high malaria endemic zone areas, especially the western regions, including the lake regions and other areas like the coastal regions. So those children who are in those areas are more likely, of course, to suffer from malaria infections, and again, more severe disease if a child is under 5 years and they have sickle cell disease. Imagine a child who has sickle cell disease has a hemoglobin of like 8. Then they get malaria, and the malaria now breaks down their red blood cells, and the hemoglobin drops further. So that is really the thing, that the connection between this malaria, the climate, and the regional distribution, and also the age, and of course the sickle cell factor coming in.
All right. Well, those in this, red zone areas, shouldn't more attention be focused on those areas? Because area like Western Kenya, you talk about Nyanza and even coast. This is where I think maybe more effort and attention should be, diverted there, so that we can try to reduce the number of cases. So, as a person, of course, who personally deals with, such kind of issues, and especially on children, what is the factors on the ground? What is happening?
Yeah, you're absolutely right. The focus should be, and actually it is, on those areas, and that's why we have the vaccines being targeted to those areas from 2019, and that we've seen from our data that yes, there's a reduction in severity of malaria in those areas, and all the other things that need to be focused in those areas where we have capacity building for health workers to be able to diagnose early diagnosis and early treatment for those children who have malaria, and we should encourage an uptake of these vaccines, so for all children under 5 years, and also we are promoting the treatment of pregnant women with the medication, so that this does not affect the children, because remember also that malaria causes premature deliveries. It causes delivery of children who what we call small for gestational age, just saying that you are a bit smaller than you are supposed to be when you are being born, and also this affects the growth of the children after. So it should be we should use all these approaches to reduce the infection, the severity, the transmission, and also we treat those cases that are being diagnosed early so that we can prevent